Animal-assisted therapy in an acute hospital setting, presented by Christine Hellstrom, occupational therapist and manager of rehabilitation services at Carey Medical Center. Carey Medical Center is a 65-bed acute care hospital located in Caribou, Maine. Patients who are admitted to the hospital often receive physical and occupational therapy treatment in the inpatient setting. These therapy services are provided to patients who need to demonstrate improved range of motion, strength, endurance, balance, ambulation, transferability, and overall self-care ability prior to being discharged home. The species that I intend to partner with in the acute hospital setting, specifically during physical and occupational therapy treatment sessions, is a dog, more specifically a miniature poodle. Poodles have wonderful traits that lend themselves to being ideal candidates for animal-assisted intervention and human-animal interaction. First and foremost, they are an extremely intelligent breed and demonstrate the ability to follow commands. They are considered hypoallergenic, with their coat comprised of hair and not fur. They are relatively small and easy to transport, weighing between 10 and 15 pounds. And they tend to have a calm and comforting temperament, especially after reaching the age of 2 years old and beyond. Not all dogs are considered good candidates to be involved with animal-assisted intervention. It is very important that a handler and/or organization partner with a dog who has demonstrated the ability to interact in an appropriate and safe way with patients. Some behavioral challenges include the following: timid behaviors such as cowering, trembling, and retreating from the patient or hospital room. This could be due to loud auditory stimuli, unfamiliar hospital equipment, and busy environments with multiple people. Anxious behaviors such as panting and excessive licking. Being too energetic, especially near patients who have decreased balance and difficulty with ambulation. Excessive barking. Agnostic behaviors such as snarling and growling. To determine if a dog is a good candidate for animal-assisted intervention, he or she should meet specific training requirements, such as the American Kennel Club Canine Good Citizen Award and the American Kennel Club Therapy Dog Certification. First and foremost, all dogs participating in animal-assisted intervention should pass a Canine Good Citizen test. This test evaluates a dog on their ability to greet a friendly stranger, sit politely for petting, walking as directed on a loose leash, move politely through a crowd, sit, lie down, and stay in place on command, come when called, behave politely around other dogs, react with confidence to distractions, be groomed with the ears and feet being touched, and be able to be left with a trusted person. Next, the dog should receive training and then certification by a qualified therapy dog organization such as the Alliance of Therapy Dogs, Pet Partners, and Love on a Leash. Finally, the canine handler can record the number of visits and apply for a therapy dog certification title through the American Kennel Club. Knowledge of behaviors which are beneficial to therapeutic interventions with physical and occupational therapy. Dogs are intelligent animals and follow commands. They demonstrate a calm and empathetic nature. They are easily redirected, especially when provided with positive reinforcement. They have a playful nature which elicits human physical interaction, and they also enjoy resting and cuddling, which elicits an overall sense of calmness in the patient. When dogs are introduced to hospitalized patients receiving physical therapy and occupational therapy treatment, the interaction may lead to patients demonstrating increased motivation to participate, increased ambulation distance, improved range of motion in upper and lower extremities, improved endurance, decreased perceived rate of pain, improved sitting and standing balance, improved functional self-care, and overall improved cognition and communication. There are also benefits associated with the animal involved in human-animal interventions. It gives the animal purpose. It provides social interaction opportunities. It provides mental stimulation for the animal, and it allows the animal to bond with humans in a safe environment. Occasionally, handlers witness animal behavioral signs that indicate stress, anxiety, fear, and aggression. Therapists may also witness a patient who does not appear to be enjoying or engaging in the animal-assisted therapy session. It is important that handlers follow behavioral ethograms and respond to environmental stimuli that may be contributing to poor animal welfare. Therapists and handlers can also offer animal-assisted therapy at a distance for patients who do not want close interaction. Perhaps the dog can sit in a doorway and the patient can interact through verbal communication. Therapists and handlers can also educate the patient on potential benefits and teach them how to appropriately interact with the animal. Promoting good behavior. It's important to reinforce good behavior in the therapy dog. There are many methods of teaching a dog good behaviors. Operant conditioning is a method of learning where behaviors are modified by either adding or removing rewards or aversive stimuli. With positive reinforcement, something is added to encourage behavior. With negative reinforcement, something is removed to encourage behavior. With negative punishment, something is removed to discourage behavior. And with positive punishment, something is added to discourage behavior. Positive reinforcement is considered the ideal primary strategy because it builds a positive bond between the dog and the handler. It builds confidence in the dog. It increases the likelihood for repeated action, and it can quickly stop undesirable behaviors. There are many challenges associated with implementation of animal-assisted therapy in a hospital setting. For example, hospitals follow stringent requirements through accrediting agencies such as the Joint Commission. Costs may be considered a challenge as hospital reimbursements and overall budgets are at an all-time low. Startup costs and ongoing canine and handler training may be cost inhibitive. Also, there are infection control perceptions associated with having animals in a hospital environment. However, the overall benefits of animal-assisted intervention should outweigh the challenges. Improve patient mental and physical health. Patients who demonstrate increased strength, range of motion, ambulation ability, self-care ability, and overall endurance may discharge sooner, resulting in cost savings to the hospital. Dogs within the hospital environment may assist with improved staff morale. And the hospital culture of incorporating a partnership with a dog to assist with optimal patient care is a wonderful marketing tool. Thank you for your time.